and we as a society tend to reject emotions a lot. So when somebody is expressing the way they feel, we tend to push it away because we maybe cannot deal with that kind of thing too much.
So says Dr. Julius Gilliard in an interview with Straight Up host Claudius Francis. The psychiatrist laments the impoverished state of mental health care in St. Lucia and calls for immediate attention for this crucial component in the island's overall well-being. Dr. Gilliard's fervent recommendations for a bolstered mental health capacity is set against the backdrop of the observance of World Mental Health Day on October 10, 2020.
How many times a year do you hear or see ads about the hotline? Only after a suicide. This should be a continuous campaign, and I've been trying to advocate for that since I came back to St. Lucia in 2017. And it comes up every now and then when there's a suicide, when there's something big happening, maybe Suicide Prevention Day in September, World Mental Health Day in October, and maybe in May. Apart from that, hear nothing about the suicide helpline.
The island has seen an increase in suicide numbers in 2020, and though suicide remains a complex problem, Gilliard says the issue has been compounded by the inability of individuals to manage their emotions.
We have poor emotional intelligence, you could call it, and it is something which I've been trying to speak of a lot, getting that brought into the school curriculum, because really and truly there's poor emotional intelligence. And that is one of the reasons we're not picking up on little signs of persons mentioning suicide, persons' changes in behavior, changes in mood, changes in their interaction and so on, so that we can get to those persons before they move further along that chain into suicide.
The World Health Organization, in observance of Mental Health Day, advocated for mental health practitioners to, quote, talk about their work and what more needs to be done to make mental health care a reality for people worldwide, unquote.
Because if the police had to go around charging people for attempting suicide, the jail would be full, totally full. Understand? So suicide is a ticklish thing, and I don't think that the helpline is being given as much airplay as it should be given.
Well, you keep saying that. I'm saying to you, I called and nobody answered.
Yes, so you see the other thing about it. So if it
and
is...
What time was it, Doc? It must have been about 7:38 when
early evening, yes, it was. You see, if it is taken more seriously, then more will be done to improve the services that they provide.
Dr. Gilliard stresses that anyone can fall prey to a diminished mental health state if stressors are not managed adequately. Solange Alfred, HTS News Force.